Hello, my name is Carlos, and in this video we're going to talk about how to obtain a pulse rate on a patient. And this is one of our easier procedures to perform. I don't think you should have too much difficulty. There are some things that you need to consider when you're taking a pulse, and so we want to kind of go over some of those things right now. Now, a pulse is really how many times your heart is beating in a minute. So that's what a pulse rate measurement is, how many times a heart is beating per minute. Adults ages 15 through 100 would be considered about 60 to 100 beats per minute. And so we're looking for something within that range. Obviously, if it's too fast or too slow, then that could be an indication of some condition going on, some underlying condition. So let's start off with the procedure. To begin, you're going to be taking your two fingers, we call this the index finger, the one you point with, and then your middle finger. We're going to take those two fingers, and you can actually use the ring finger as well to take a pulse. When you take a pulse, you're going to actually be placing these fingers on what we call the radial artery. And you can do the radial artery of the left hand or the radial artery of the right hand. It doesn't really matter which one you use. You can see that I have a watch on, and if your patient has a watch on, that might get in the way. So I'm going to take the watch off so that I can take a radial pulse. Also, you want to make sure you have a watch or a clock with a second hand so that you can start counting those beats per minute. If you don't have a watch or a clock, you're going to have to find something to measure that 1 minute time frame. I have a clock on the wall. It has a second hand, and so I'm going to be following that second hand. Now you can start when the second hand reaches 12 or maybe 3. Some people might start at 6 or at 9, but start at a point where you know you're going to follow that all the way until it returns to wherever you began. So I can see that ours is getting ready to approach 12. When it gets to 12, our fingers should already be in place. So you're going to take 2 or 3 fingers. Sometimes 3 fingers will help you feel it a little bit better. And you want to place those fingers on the thumb side of the wrist. So that's the thumb side, not the pinky side. You're going to place your fingers on the thumb side of the wrist and begin pressing until you feel that pulse. For some people, you have to press a little bit harder. For some people, you don't have to press too hard before you start to feel it. Make sure you feel it and you're comfortable and you're ready to go with the count. You don't want to lose your spot and then lose count in the middle of the procedure. So make sure that you place your fingers in the correct place, but also in a position that's comfortable for you. Once you get your fingers on the pulse and you begin to feel it, that's when you need to start thinking about beginning your count. And so actually the clock has gone around and now it's about approaching 12 in about 5 seconds. So in about 5 seconds, I'm going to begin my count. As soon as the second hand hits the 12, let it hit the 12 and then you begin counting immediately after. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63. It's important that you count these pulses that you feel very carefully, and that you're not just simply counting the ticks of the second hand moving across the clock, tick, 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 tick. You're actually counting the pulse that you feel. Something that I want to talk about is that oftentimes as you're pressing on the pulse, you get distracted, you stop thinking about how much pressure you were placing initially to feel it, and you start letting off that pulse, that pressure. And it's very possible that somewhere between 0 and 60 seconds that you no longer feel the pulse. If that's the case, you really have to start over. Start over, find the pulse again, begin counting again on the second hand, and go for another 60 seconds. The point that I want to make is that it's important that you get an accurate reading every time. If you're not sure, take it again. Some patients will have irregular pulse rates where it can be a little confusing, where it goes and then it speeds up. In that case, their heart has an irregular rhythm, and it can be a little tricky to keep up with it. But the point that I want to make is it's important that you count every pulse accurately. If you get lost or you lose track, begin again so that you're not guessing. It's so important not to guess with this procedure. Thank you very much.